Hello warriors, thanks for joining in. Today we will have a look at 5 different things that an AS warrior should always be aware of. So many times it so happens that a new symptom comes up and a lot of precious time is wasted in knowing whether this is related to ankylosing spondylitis or not related, and whether to see a rheumatologist or a general physician for this. The first one is dactylitis. What exactly is dactylitis? Dactylitis is inflammation of the entire toe or finger. As you can see here, these 3 toes are swollen in their entirety. You can always compare it with the toes on the other side. One more photo, you can clearly see the entire toe is inflamed. It's not a single joint of the toe, but the entire toe is inflamed. You can compare it with the other toes. One more, clearly see dactylitis. This is what is dactylitis all about. If you develop anything of this sort, you should see your rheumatologist immediately, because this is related to ankylosing spondylitis. Secondly, peripheral arthritis. Peripheral arthritis would mean inflammation involving the knee, ankle, foot, hand or elbow. As you can see, clearly inflamed knee. If you develop any of these swelling involving any of these joints, you should be seeing your rheumatologist as soon as possible. This is related to ankylosing spondylitis. Thirdly, enthesitis. What exactly is enthesitis? Enthesitis is inflammation in the area where a ligament, a tendon or a muscle attaches to a bone. As you can see here, you can clearly see inflammation, swelling here. What is this all about? Let's have a look. See, it is this tendon which gets attached to the bone called as calcaneum. This is the enthesial area, and this is what is inflamed. This is again something very classical of ankylosing spondylitis. You can see the inflamed here, enthesis here. There are other sites as well. It's not the only site. Again, one more photo showing enthesitis, inflammation in this area. One more photo showing enthesitis in this area. In fact, there are multiple sites. As you can see, nape of the neck, the entire vertebral area, in fact, is enthesial pain. The crest, the hip bone crest, where you can have pain. Both the sides of the knee where you can have pain, elbow area where you can have pain. In fact, an easy way to identify enthesitis is if the pain is localized to a very limited area with localized swelling which may be above or not near a joint, it is very likely to be enthesitic, and you need to consult your rheumatologist as early as possible. The heel pain that many people have with ankylosing spondylitis is again an enthesitic pain. There is a fascia called as plantar fascia which get attached to the undersurface of the bone called as calcaneum. This enthesis becomes painful, inflamed, and ultimately causes heel pain, plantar fasciitis. Something else that you should also be aware of is uveitis. It is inflammation of the uvea, a part of the eye. It causes severe eye pain, blurred vision, redness, and sensitivity to light. You should be seeing your rheumatologist and ophthalmologist as early as possible if you develop red eye. Lastly, loose motions, particularly loose motions that are recurrent with a lot of mucus and blood and accompanied by abdominal pain, can be a part and parcel of ankylosing spondylitis. You should be talking to your rheumatologist if you ever develop these type of loose motions. So then, this was the AS video this week. Join me again next week. Thank you.